Welcome to the Canna-Science Digest, where we have 9 papers to rapid fire through this week. This is sponsored by CVResearch, the makers of Plus CBD, who has excellent CBD and THC products for shipping anywhere in the US. First, the big one is this meta-analysis that looked at 90 papers that covered 22,000 patients. They were comparing opioids versus cannabinoids in terms of treating chronic pain. And they found low-quality evidence to suggest little to no difference between cannabis and opioids for pain relief or for sleep quality. Furthermore, cannabis resulted in less discontinuations due to adverse effects. And then 2 papers related to using opioids and cannabinoids together. This one is in mice, and they're giving THC and oxycodone to them for their chronic pain. And they found that THC delayed the formation of opioid tolerance, and that THC did not augment the negatives of the oxycodone, except for its rewarding properties, which means the mice liked it more. And then the other study looked at drugs that were negative allosteric modulators of the CB1 receptor, which includes CBD. And what negative allosteric modulators do is they bind the receptor and slightly change its shape so other drugs don't bind there as well, such as THC. In this case, when they combined that drug that was a negative allosteric modulator of CB1 with morphine, it still allowed the morphine to do the same amount of pain killing, but it meant less tolerance developing to the opioid as well as less withdrawal symptoms from the opioid. Overall, these studies point to why, in surveys of patients, painkilling is always at the top of the list for both THC and CBD. And if you want to see more, go to the CVResearch.info and see all of the pain studies I have collected there. Next big area is vascular diseases and potentially treating them with CBD. Because vascular diseases, or diseases of your small blood vessels, really surgery is the main option. There aren't a ton of good pharmacological treatments there. And while most of the studies that they reviewed in this were studies in animal models, they suggest that CBD could be helpful for some of these vascular diseases. The diseases mentioned include atherosclerosis, which is hardening of the arteries, stress-induced hypertension, diabetes-related vasculopathy, ischemia-reperfusion injury, which is generally a heart attack or stroke and the blood flow coming back in that area, and that can be damaging, and then vascular damage caused by smoking and alcohol abuse. This great chart from the paper talked about a lot of the mechanisms and pathways that are used, but a lot of it had to do with antioxidant effects, with the lowering of inflammation, as well as improving the vascular barriers, and in the brain damage one, actually inhibiting the downregulation of electrical activity in the brain and helping things to heal and lowering the amount of dead cells that would be left behind. Lastly, the ability of CBD to help people stop using tobacco products or alcohol products would also help their vascular health. And finally, 5 cool studies in animals that I just really wanted to mention. This is one in mature horses with osteoarthritis, and a 15% CBD paste reduced their pain and inflammation as well as improved their overall health. Then in this rat model of exhaustive exercise, which I haven't experienced since college wrestling, CBD protected their skeletal muscle from damage via their mitochondria, the powerhouse of the cell. In a mouse model of nicotine addiction, CBD lessened their signs of withdrawal. In a mouse model of colitis, dietary CBD lessened their chronic inflammation and improved their leaky guts. Finally, in a skin tissue model of psoriasis, CBD lessened inflammation via the T cells of the immune system.